Handle with Care is a new initiative connecting first responders to local schools to help support the needs of students involved in critical incidents. This presentation will explore the origins of the Handle with Care initiative, how it will be used, and the tools and processes involved in working it. Handle with Care was designed to reduce the negative impacts of traumatic events on school-aged children. More than half of U.S. families have been affected by some type of disaster. More than 2/3 of children reported at least one traumatic event by age 16. 19% of injured and 12% of physically ill youth have post-traumatic stress disorder. The kinds of events that are considered traumatic are experienced with more regularity, and we're seeing a greater impact on school-aged children. In addition to homelessness, abuse or neglect, community or school violence, witnessing or experiencing domestic violence, sudden or violent loss of a loved one, other events might include exposure to invasive medical procedures, living with someone who has trauma through combat, being removed from parental care, natural disasters, or being exposed to a family member taken away by an ambulance. Here's a list of common signs of trauma in school-aged children. Things to look out for in preschool children is a fear of being separated from their parent or caregiver, eating poorly or losing weight. In elementary school children, they might experience feeling guilt or shame, having difficulty concentrating or difficulty sleeping. Middle and high school children feel depressed or alone, can begin using alcohol or abusing drugs, and become involved in risky sexual behaviors. All of these are signs of trauma in children. Examples of problem behaviors in children that are directly linked to trauma are truancy, involvement with crime, violent behaviors, and drug use. Trauma is a risk factor for nearly all behavioral health and substance use disorders in children. In Asheville City and Buncombe County, we are initiating the Handle with Care program. In this program, law enforcement, emergency and fire services professionals will collaborate with Asheville City and Buncombe County schools to assist teachers and administrators with supporting those children who have experienced a trauma. Currently, there are 3 states who have developed this program statewide. These states have experienced a reduction in adverse behaviors in children overall. As Asheville City and Buncombe County schools have access to mental and physical health professionals in the schools, and as their teachers and administrators are trained in trauma-informed strategies, this initiative will provide the schools with direction to assist and support those children who were involved in a traumatic event. When a first responder is on scene for a traumatic event, and they identify that a school-aged child is also on scene, they will obtain the child's name, birth date, and the school that they attend. They will then contact either Asheville City or Buncombe County schools and provide this information using the Handle with Care phone number. At that time, Asheville City or Buncombe County school system will alert the child's teacher and administrators and let them know that that child was involved in a traumatic event by saying that child needs to be handled with care. If possible, the teacher or administrator will ask the student what they need or provide them options to help them understand what they can ask for throughout the school day. For example, a teacher or administrator might ask if the child slept the night before, or if they had breakfast that morning. They may also offer support in the ways listed here. However, if the student indicates they are okay, the teacher or administrator may simply let them know that they are available to help them if needed. School staff will not question the student or seek other information about the event. So ideally, the first responder will identify when a child is involved in a traumatic event, obtain the necessary information, and provide it to the school system. The school system will then notify the specific school the child attends. The child's school will then provide support to the child throughout the school day and monitor them to determine if they need additional supports like counseling or any medical attention. Asheville City and Buncombe County Schools have provided a phone number that a first responder will use when they identify a school-aged child has been involved in a traumatic event. This phone number will lead to a voicemail that will collect the 3 items of information that will be provided by each first responder. The school system will monitor this voicemail, and each morning they will then contact that child's school and let them know that they need to be handled with care. These are the numbers that you will use in the Handle with Care initiative. If you identify a child who attends a Buncombe County school, you will call 828-225-5274 and provide the child's name, their birth date, and the Buncombe County school that they attend, and you will say Handle with Care. If you identify the child attends an Asheville City school, you will call 828-713-7258 and then identify the child's name, birth date, and the school they attend, and list that they should be handled with care. For any additional information, you can contact any of the people whose emails are listed here. They will help you and try to answer any questions that you may have. Thank you.